Good day, I'm Pearl Angelis from BSN1B, and for today I will be doing the assessment of female genitals and inguinal area. Now, the purposes of this assessment is first to assess for any abnormalities of the genitourinary system, to diagnose disorders and diseases of the entire urinary tract and the genital tract, also to plan an appropriate intervention pertaining to genitourinary problem, and lastly, to evaluate for improvement and response to management. Now, following the nursing procedure, first I will be determining or assessing the following, such as the presence of factors that might increase the susceptibility to infection and any possible undiagnosed infection such as HIV. Also, I will be checking if the patient has undergone recent diagnostic procedures or treatment that might penetrated the skin or the body cavity. And lastly, I will be reviewing the chart of the patient for the need of genitourinary assessment. Now, I will be proceeding to the client history taking. So, good day ma'am. I'm Percival po, your student nurse for today. May I know your name po? How about your age po? Okay, for today ma'am, I will be asking you some questions. Would it be okay for you? Okay ma'am. So, may I know po your age at onset of menstruation? Okay po. How about the last menstrual period po? Okay po. Talking about your menstruation period po ma'am, may I know po yung regularity niya? Is it regular or irregular po? Okay, how about the duration po? Okay, how about naman po yung amount of daily flow po ninyo? Okay, do you experience menstrual pain po? Okay po. Also, I will be asking the patient for incidence of pain during intercourse, vaginal discharge if it is present, if the patient already experienced being pregnant, then the number of pregnancies, live births, and labor or delivery complications. Okay, ma'am, have you had incidents of pain po during intercourse? Okay, but how about po presence of vaginal discharge? How about po, ma'am, nabuntis na po ba kayo? Okay, how about po yung number po of pregnancies niyo? Okay, ma'am, may I know po also yung live births, number of live births po? Okay, have you any experience labor or delivery complications po? Okay. Also, may I ask po about urination niyo po, the urgency and frequency, meron po kayong experience na gano'n? How about painful urination po? Okay, how about blood in urine po? Incontinence po or yung pag-leak po ng urine niyo? Okay, last na po ma'am, may I know po if you have any history of sexual transmitted diseases, both past and present? Okay, thank you ma'am for answering those questions. I will make sure po that they will be confidential po. Thank you. After that, I will now be doing the planning. So I will plan properly the steps needed for the assessment of the patient's genital and inguinal area. And then I will be assembling the equipment, which is the examination glove, the drape, and the supplemental lighting if it is needed. Also, I will now proceed to the implementation. So I will introduce myself to the patient, verify my patient's identity, and then explain the procedure that I will be doing, and why is it necessary, and how the client can cooperate during the procedure. Also, I will be securing a proper consent from the patient before starting the procedure. So I have just introduced myself earlier and verify my client's identity. So I will now explain the procedure. Okay, ma'am, for today po kasi, I will be assessing you po, especially your genital area and your inguinal area po, para po ma-determine yung any abnormalities or problems po sa inyong system. Also, para na rin po ma-determine ko yung health status ninyo. Will that be okay sa inyo, ma'am? Okay po, I'm going to ensure po na this will be done and performed privately. Okay po ba yun, ma'am? Okay, thank you po. Now that I'm already done in securing the consent of my patient, I will now perform proper hand washing or hand hygiene and perform a proper gloving. After that, I will be providing for my client's privacy to maintain my client's dignity. So I will be closing the curtains around the bed, the door to the room, and especially the windows of the room. And then I will now position my client in supine position with feet elevated in the stirrup of the examination table, or alternately I can place my client in a dorsal recumbent position with knees are flexed and then the thigh are externally rotated. So ma'am, let me help you po and assist you in a proper position. Then after that, I will now be going to assess the pubic hair first of my client. So I will be inspecting the pubic hair for amount, the distribution, and the characteristics of the pubic hair. Okay ma'am, I will just inspect na po your pubic hair. Okay po. Okay. Now, I will inspect the pubic hair. So, the pubic hair is not trimmed and it distributes evenly with a position of inverted triangle. And there are also no presence of any lice or nits on the pubic hair, which indicates that there is no presence of pediculosis, pubis, or crabs. Now I will be inspecting the skin of the pubic area by separating the labia majora and labia minora with my thumb and first two fingers. So I will be noting for any lesions, for any parasites, presence of parasites, and also inflammation, swelling, and nodules. So I will just separate them. So the labia majora is equal in size. Also, it is free from any lesions, and there are also no inflammation and swelling as well. The skin of the pubic area has no any presence of parasites as well, and there are no lesions, there are no nodules, there are no swellings, and there are no inflammations. Also, if the patient have given birth, we can, or the healing scar might be visible, or yes, the healing scar might be visible. So it's normal. Now, I will be inspecting the vagina. So I will be inspecting the clitoris, the urethral orifice, and the vaginal orifice by separating the labia minora this time. So I will be noting for any abnormalities and vaginal discharge this time. So I will separate the labia minora. So this is the clitoris. So there are no any abnormalities within it. With the urethral orifice as well and the vaginal orifice, there are no lesions, inflammations, or swelling. And then there are also nodules. And then the labia minora is symmetric. Also, it is dark pink and it is moist. And the perineum, or the overall perineum, is smooth in touch. So there are also no presence of vaginal discharges. Now, I will be, after that, I will be inspecting the inguinal area of my client. So I will be palpating it and see if there is presence of hernia, bulging, or inflammation, swelling, or I can palpate nodules and lesions. I will palpate it. So there are no presence of nodules, there are no palpated inflammation, swelling, or hernia. Okay ma'am, done na po tayo. Let me just fix you. Now I will be documenting the findings on the client records, and then I will be now removing my gloves and perform hand washing or hand washing. After performing proper hand washing and placing the gloves on the appropriate receptacle, I will now be reassessing my patient to assess for any discomfort or any problem after assessing the patient's genital and inguinal area and ensure the patient's comfortability. So, ma'am, are you comfortable po? Okay, wala naman pong masakit sa inyo. Okay po, thank you po, ma'am. Now, that's all for the assessment of the female genitals and inguinal area. Now, moving on, I will be demonstrating to you the assessment of the male genitals and the inguinal area. And the purposes of this assessment is first to assess for any abnormalities of the genitourinary system, to diagnose disorders and diseases of the entire urinary tract and inguinal area, also to plan an appropriate intervention pertaining to genitourinary problem, and lastly to evaluate for improvement and response to management. Now, following the nursing process, first I will be taking the client's history. So, good day sir, I am Principal po, your student nurse for today. May I know po your name? How about your age po? Okay sir, may I ask a few questions about you po? Would that be okay? Okay sir. Sir, may I know po your voiding patterns and any unusual changes? How about po your bladder control? How about po your urinary incontinence, urgency and frequency? Na-experience niyo na po ba? Okay, how about po abdominal pain? Naka-experience po kayo? Okay po. How about po yung presence of swellings po or inflammation that might indicate presence of hernia? Nakaramdam na po, naka-experience po? Okay po. How about po any symptoms po of sexually transmitted diseases? Meron po ba? Okay, lastly na po, how about family history of nephritis? Malignancy of prostate po? Malignancy of kidney? Okay po, thank you po. I assure you po na all the questions you've given to me will remain confidential po. Okay po sir, thank you po. After that, I will now proceed to the planning, in which I will properly plan the steps needed for the assessment of the patient's genital and inguinal area. And then I will be assembling the equipment needed, which is an examination glove, a drape, and supplemental lighting if it is necessary. Then, after that, I will now proceed to the implementation. So, I will introduce myself to the patient, verify my client's identity, and then I will explain the procedure, why is it necessary, and how the client can cooperate. And I will also secure a proper consent from my patient before doing the procedure. So, earlier, I have just introduced myself and verified my client's identity. Now, I will be only explaining the procedure. Okay, sir, for today po kasi I will be assessing your genitals and your inguinal area para po ma-determine yung health status and any underlying problems or abnormalities. Would that be okay po sa inyo, sir? Okay po, and ensure you po that during the process or the assessment, it will be done privately po. Okay po? Okay. So, after that, I will now perform proper hand washing or proper hand hygiene, and I will wear or I will do proper gloving. So, I will be wearing my gloves. Then after this, I will provide for my client's privacy to maintain his dignity. So I will be closing the curtains around the bed, the door to the room, and the windows of the room. Then I will now position my client. So I will position my client in a supine, or if it necessary, in a standing position. Or alternately, I will position my client in a dorsal recumbent position with knees flexed and the thighs are externally rotated. So let me just assist you, sir. Now I will be inspecting the pubic hair first of my client for its amount, distribution, and characteristics, and then I will also inspecting the skin of the pubic area for any presence of parasites, inflammation, swelling, and lesions. Okay, sir, I will start na po sa assessment, okay? Okay. So, I will inspect the pubic hair. So, the pubic hair is evenly distributed along the genital or the groin area. And there are no presence of flies or nits which might indicate pediculosis pubis or commonly known as grubs. And also the skin of the pubic area, there is no any swellings or inflammation, nodules, and there are no any enlargement. After that, I will now be inspecting the penile shaft and the glans penis for presence of lesions, nodules, inflammations, and swelling. So first, I will inspect the penile shaft. So the skin of the penis is slightly wrinkled, which is considered normal. There are also no inflammation, no swellings, and no enlargement, and no nodules as well. And for the glans penis, it appears round and smooth, and there are no also lesions, rashes, and redness and enlargement. Now I will be inspecting the urethral meatus for swelling, enlargement, or inflammation and discharge. So, in inspecting or doing that procedure, I will be compressing or I will ask my client to compress the glands to open the urethral meatus for me to inspect the discharge. So, I will compress it and inspect for discharge. So, if a client has reported any discharge, then I will be asking my client to strip the penis from the base to the urethra, just like this. And then after that, I will palpate the penis for tenderness, thickening, and nodules using my fingers, like my thumb, and the first two fingers. So I will palpate it. So there is no thickening or any tenderness. And there are also no nodules palpated. After that, I will now proceed to inspection of the scrotum. So in doing that procedure, I will ask my client to hold the penis out away for me to have clear visualization of the scrotum. So first, I will be inspecting it for its appearance, general size, and symmetry. So the the left scrotal sac hangs lower than the right, which is normal. There is no inflammation, and there is no nodules and lesions and enlargement. Then I will also inspect all the skin surfaces by spreading the irrigated surface skin and lifting the scrotum to observe the posterior area. So the skin of the scrotum is thin and irrigated or slightly crinkled. Also, it is there are visible or slight dispersion of hair, and then it is darker compared to the color of the penis. And for the posterior, there are no inflammations, swellings, or abnormalities. Now I will be palpating the scrotum to assess for underlying testes, epididymis, and the spermatic cord. So I will palpate both scrotum simultaneously for comparative purposes. So there is no any lesions or nodules palpated, inflammations as well. The scrotum feels smooth and firm. It is also mobile, and there are no also tenderness. After that, I will now be palpating the inguinal area of my client. So first, I will ask my client to stand, and then I will ask him to remain relaxed, and then hold his breath, and then strain or bear down, which means or seems like he's having a bowel movement. And from that, I will be palpating the both inguinal area for bulging, presence of hernia, presence of lymph nodes, inflammations, and swellings and nodules. So there are no presence of lymph nodes as I palpated. Also, there are no presence of hernia and inflammation. After that, I will document all the findings on the client records. Okay, sir, done na po tayo. And then, for the evaluation, I will be removing the gloves I used. And then, I will place it in an appropriate receptacle and perform hand hygiene. And then, I will reassess my patient for any discomfort and problem after assessing the patient's genital and inguinal area, and ensure the client is comfortable. Okay, so comfortable lang po ba kayo? Meron po ba anyong sakit? Okay, sir. Now, that's all for the assessing of the male genitals and inguinal area. Thank you.